Governor Kemp trying to provide some additional relief for our understaffed hospitals. He is calling out the Georgia National Guard once again for help. John Sherrick live at Grady Hospital, one of those stressed hospitals that needs additional help.
Governor Kemp is getting ready to send in an additional up to 2,500 National Guard troops to help Grady and other hospitals across the state that are stretched thin.
Georgia's governor signing an executive order authorizing the deployment of up to 2,500 more National Guard troops, sending them into emergency rooms and ICUs across the state that are overflowing with COVID patients. Non-medical troops available to support the medical frontline workers who are trying to save lives. Governor Kemp says his #1 priority, though, is to convince people to get vaccinated and wear masks. No state mandates. Do it voluntarily, he says, or accept the potential consequences.
But the fact is, you're going to remain at risk of being in the hospital with COVID-19. And you run the risk of being on a ventilator for 2 or 3 weeks and then dying.
Atlanta Mayor Keisha Lance Bottoms says the city's mask mandate remains in place for everyone indoors, and the city is expanding pop-up vaccination sites all over town. Bottoms still believes the state should impose mask mandates on top of encouraging vaccinations and sending in the troops.
We can't send conflicting messages. We've got to do all that we can to protect people throughout this state. If you're in closed spaces, if you're indoors, wear a mask.
Governor Kemp says for the first time, some 325,000 state employees are eligible to receive cash incentives to get vaccinated. The incentives offered through their health plan.
Masks and vaccinations continue to be so divisive across this state. Georgia's Commissioner of Public Health says nurses and other medical workers at vaccination sites are receiving threats in person, in emails, on social media. In fact, she says one mobile vaccination site had to shut down because of all the threats. Ron.
All right, John, thanks a lot for the update there.